Hi guys, this PowerPoint presentation is about mammography. That's my topic, and let's begin. What is mammography? Mammography is a specialized medical imaging that uses a low-dose X-ray system to see inside the breast. This exam aids in the early detection and diagnosis of breast diseases in women. Let's talk about advances in mammography. We have digital mammography, we have CAD, which is computer aided detection, and we also have breast tomosynthesis. Digital mammography is a mammography system in which the X-ray film is replaced by electronics that converts X-rays into mammographic pictures of the breast. Its efficiency enables better pictures with a lower radiation dose. These images of the breast are transferred to a computer for review by the radiologist and for long-term storage. We also have CAD. System search digitized mammographic images for abnormal areas of density, mass, or calcification that may indicate the presence of cancer. The CAD system highlights these areas in the images, alerting the radiologist to carefully assess the area. And breast tomosynthesis, also called three-dimensional mammography and digital breast tomosynthesis (DBT), is an advanced form of breast imaging where multiple images of the breast from different angles are captured and reconstructed into a 3D image set. Large population studies have shown that screening with breast tomosynthesis results in improved breast cancer detection rates and fewer callbacks, instances where women are called back from screening for additional testing because of a potentially abnormal finding. What are some common uses of mammography? Well, we have screening mammography and diagnostic mammography. Screening mammography plays a central part in early detection of breast cancers because it can show change in the breast years before a patient or physician can feel them. It is recommended screening mammography every year for women, beginning at age 40. Research has shown that annual mammograms lead to early detection of breast cancers when they are most curable and breast conservation therapies are available. Diagnostic mammography used to evaluate a patient with abnormal clinical findings such as breast lump or nipple discharge that have been found by the woman or her doctor. Diagnostic mammography may also be done after an abnormal screening mammogram in order to evaluate the area of concern on the screening exam. Preparation for the exam. A mammography should not be scheduled for the week before the menstrual cycle. 1 week after the duration is the safest time to use the mammogram. If there is a risk of pregnancy, the doctor should always be told or an X-ray technologist. It is advised to not wear deodorant, talcum powder, or lotion on their arms or breasts on the day of the examination, which may appear as calcium spots on the mammogram. Any signs or complication of the breast should be identified to the technologist conducting the test. Previous mammograms should be collected and made available to a radiologist if they have been conducted at a different venue, which is important for comparison with the current test. What does the mammography equipment looks like? A mammography unit is a rectangular box that houses the tube in which X-rays are produced. It is used exclusively for X-ray exams of the breast, with special accessories that allow only the breast to be exposed to the X-rays. Attached to the unit is a device that holds and compresses the breast and positions it so images can be obtained at different angles. Breast tomosynthesis is performed using digital mammography units, but not all digital mammography machines are equipped to perform tomosynthesis imaging. So now, how does the procedure work? Well, X-rays are a form of radiation like light or radio waves. X-rays pass through most objects, including the body. Once it is carefully aimed at the part of the body being examined, an X-ray machine produces a small burst of radiation that passes through the body, recording an image on photographic film for a special detector. In digital mammography, a stationary X-ray tube captures an image from the side and an image from above the compressed breast. In breast tomosynthesis, the X-ray tube moves in an arc over the breast, capturing multiple images from different angles. How is the procedure performed? During mammography, a specially qualified radiology technologist will position your breast in a mammography unit. Your breast will be placed on a special platform and compressed with a clear plastic pad. The technologist will gradually compress your breast. Breast compression is necessary in order to even out the breast thickness so that all the tissue can be visualized. Spread out the tissue so that small abnormalities are less likely to be hidden by overlying breast tissue. Allow the use of a lower X-ray dose since a thinner amount of breast tissue is being imaged. Hold the breast still in order to minimize blurring of the image caused by motion, and reduce X-ray pattern to increase sharpness of picture. You must hold very still and may be asked to keep from breathing for a few seconds while the X-ray picture is taken to reduce the possibility of a blurred image. The technologist will walk behind a wall or into the next room to activate the X-ray machine. This examination process should take about 3 minutes. Screening mammography has some benefits like reduces the risk of death due to breast cancer. It is useful for detecting all types of breast cancer, including invasive ductal and invasive lobular cancer. Screening mammography improves a physician's ability to detect small tumors. When cancers are small, the woman has more treatment options. Also, it increases the detection of small abnormal tissue growths confined to the milk ducts in the breast, called ductal carcinoma in situ (DCIS). No radiation remains in a patient's body after an X-ray examination, so X-rays usually have no side effects in the typical diagnostic range for this exam. Risks include that there is always a slight chance of cancer from excessive exposure to radiation. However, the benefit of an accurate diagnosis far outweighs the risk. The effective radiation dose for these procedures varies. We also have false positive mammograms, which is 5% to 15% of screening mammograms requires more testing such as additional mammograms or ultrasounds. And women should always inform the physician or X-ray technologist if there is any possibility that they're pregnant. Now let's talk about limitations. It is very important that to realize that not all breast cancers can be seen on mammography. Interpretations of mammograms can be difficult because a normal breast looks different for each woman. Also, the appearance of an image may be compromised if there is powder or cell on the breast or if you have undergone breast surgery. Because some breast cancers are hard to visualize, a radiologist may want to compare the image to view from previous examinations. Breast implants can also impede accurate mammogram readings because both silicone and saline implants are not transparent on X-ray and can be block a clear view of the tissues around them, especially if the implant has been placed in front of rather than beneath the chest muscles. Experienced technologists and radiologists know how to carefully compress the breast to improve the view without rupturing the implants. This image is showing us four different types of normal breast tissue. Here on this one, we can see breast calcification, the little white dots by the nipple. This image is showing us fibrocystic tissue. On this image, we can visualize a cancerous breast tumor, which is literally right there, clearly visible. and on this one breast implants are visualized.